Hi everyone, my presentation topic are acute promyelocytic leukemia APML. Okay, what is APML? APML is a cancerous disease of the white blood cell in the bone marrow and peripheral blood. It is a subtype of the AML and is commonly seen in adult. My objective is first to diagnose the acute promyelocytic leukemia. Second, to learn how to perform the laboratory diagnosis. Okay, introduction. Okay, introduction about the patient. Okay, a 26 years old Malay male presented to hospital with complaint of lethargy, dizziness, palpitation. Patient history show no previous fever, bone pain or malaise, but did indicate easy fatigue after physical activity. All the symptoms precede for 2 days. Otherwise, he don't have any bleeding tenderness, no blackish stool or hematemesis, and no high risk behavior. Patient cardiac, respiratory and neurological status was normal. And then at initial evaluation, the patient complained of headache in recent weeks but lack other abnormal symptoms. Okay. Clinically, patient alert, lethargy, pallor and jaundice. At presentation, chemistry, coagulation and hematologic tests were ordered, and which include a bone marrow aspiration and biopsy. Okay, next slide is overall of illness. Okay, the cause of the sign and symptoms were unknown. Laboratory result confirm a persistent disease state of acute promyelocytic leukemia. After identify the disease, patient have been given antibiotics. Diagnosing time is very precious. Seems this disease is very dangerous, which can lead to a death because it is a white blood cell cancerous cell. Okay, next the laboratory result. Okay, the initial laboratory result show severe anemia with HB 4.6 and WBC 1.77 and RBC 1.70 and platelet count is 34 and the neutrophil count is 13% and 50% blood cell seen. Okay, next is the peripheral blood film result. Okay, RBC it show severe anemia. Many teardrops with occasionally polychromatic cell, fragmented red cell and nucleated RBC seen. Next for WBC, we can see many circulating blood cells seen. 50% is considered high. The blasts are moderate to large in size with slightly abundant bluish cytoplasm. Okay, and then for platelet, we can see large and giant platelet but not clump platelet. Next we can see bone marrow aspiration. Okay, the bone marrow aspiration relieve 90% leukemia blasts. Morphologically, the blasts were medium to large size and mostly granular with a few granular blasts. Scanty cytoplasm. Large nucleus, high nucleotic plasmic ratio. And then for flow cytometry result, it show 94% of WBC of increased forward and side cataract, including CD33 on 100% O cell and CD13 on 64% and a dim HLA-DR expression. Okay, next this is a picture of under microscope. The complete blood count is differential relieve a typically promyelocytic cell with aureole rod and granulation, anemia and thrombocytopenia. This with platelet count of 34. Okay, next discussion is, in discussion, APML generally presented with panthopenia and coagulopathy with or without disseminated intravascular coagulation. The most common morphological type is the hypergranular APML catarrh, characterized by an increase in abnormal promyelotic and large blasts that will show an increased size cataract and commonly express the surface antigen CD33, CD30 and negative for HLA-DR expression. APML should be suspected if these features are presented and should be confirmed by urgent cytogenetic FISH testing or PCR assay for PML. Okay, but this case will be easy if the patient history was clear. In Cooling Hospital, they won't allow us to take patient history from the ward. So, the patient have the characteristic feature to suspect APML at diagnosis. Okay, at presented treatment, it did not require fresh frozen plasma or cryoprecipitate, but the patient was given a broad spectrum antibiotics and saline or sodium bicarbonate hydration. Okay, last but not least, conclusion. For further investigation and treatment, the patient referred or sent to another hospital. So the time of diagnosis, any disease is very precious to save the patient life. History of patient play an important role in diagnosis. Therefore, clear and correct details need to be collected. Advanced technology should be practiced in order to save time and life. This is my reference. That's all. Thank you very much for listening.